Hi, welcome to another episode of Startup Strides. Today, I'm joined by Andreas. He's a co-founder and CTO of Genie Fertility. They want to bring precision care into uterine health. I have a lot of questions, but first, welcome, Andreas.
Hi, Javid. Very nice to be on the podcast.
I'm very glad to have you on. And I guess I'm just going to jump right into the questions. And I always like to start first with a bit of a background. You have an interesting background profile. So my next question to you, considering your academic background, would be: is being a founder or was being a founder always part of the plan?
I guess I was always into building things. I remember when I was a kid, I was maybe like slightly more audacious and less practical. I got all my friends and we tried to build a time machine because I was really excited by space and traveling through time. And I was like, all the whole thing, like black holes, everything. And yeah, so since then, I think as I started learning more about bio and health, I got really excited about the small stuff and like how actually like human organisms work. Like are we alive? Like how do we do things? Like how does this very complex thing function? And that led me to bio. But I think I was always the idea that like I'm not just doing bio to like learn stuff. Obviously, I want to learn stuff, but I also want to build something that's useful. And that led me to do synthetic biology later, and that led me to found this, I think, as well. And it was only in my PhD that I formulated this as I want to be a founder, I think. Before that, I was more like, I want to build stuff and I want to have stuff with applications. But yeah, like before at my PhD, I realized, innovation is a thing and startups are a thing. And let's just become a founder, actually build this and like make something great.
Was there anything in academia that pushed you in the other direction?
Hmm. I think I would like in academia, sometimes you always have this idea that it's almost immoral not to stay in academia sometimes. But like for me, I was always slightly odd because even in my undergrad, like everybody was saying they want to stay in academia and they want to do things. Like I don't want to stay in academia, I just want to do something cool. And I was very resilient to that. I think I went into academia very much with the mindset that I want to learn as much as I can. And like I'm interested in obviously the process of research because that is fundamental to understanding things and like doing cool stuff. But ultimately what I want to do is apply this somewhere that is has real world impact.
And that's what appealed to you in biology because you wanted to have that impact on human lives, essentially, right?
I think so. I think so. I think it started as genuine curiosity about how do we work, but then it became a plus. I think that actually you can apply this and this has an impact. I don't think I could have done an element of science that is not like. Yeah, I mean, for me, I'm also really interested, like curiosity-wise, in linguistics, but it's not something that I can see us directly, obviously, having real world impacts. So I think biology won over that.
Andreas, I feel like we do have quite a few common interests. I like anthropology, history stuff. When I was a kid, I would break down things to find dynamos to build things. And I was also very into biology. I ended up studying biochemistry undergrad. So there's quite a few similarities. I guess natural progression from your founder perspective would be the startup you founded, which is Genie Fertility, right? You guys are going after a very interesting, um, a very under-researched, I guess, underfunded area, it's a theme that I will mention a couple more times during this podcast. Um, which is you're trying to turn a black box of uterine health into data-driven science. I'm curious, like, first, what are you building with Genie Fertility? And two, how does that idea come about? Like, what specifically pushed you to pursue this specific area?
So I think, like for me, it comes from again my undergrad and my PhD that I really got into this idea that with data in biology we can push biology. I mean, we used to say maybe 5 years ago push it into becoming more of an engineering discipline. I mean, maybe that's kind of passé now, but I do think that that is very much a thing that we need to understand more about how biology works and we need to use numbers versus essentially more intuition or like skills and wet lab skills to understand what biology, how like different data points interact. And it's like so much data in bio. So when I did my undergrad, I worked a lot in hematology and blood cancers and did all of like the large scale screens and the computational modeling as well. And Then during my PhD, I went more down the synthetic biology route and essentially looking at biomarkers, a bit of diagnostic development as well. But ultimately, when I finished, what I wanted to do is use this understanding and this data and this almost like, like engineering state, like sort of mathematical approach to biology to find an area of health that is underused and underappreciated more than underused, I want to say. And I looked a bit around. I like it wasn't that directly I want to build something in women's and uterine health. And then I met my co-founder who had done the opposite. She has spent the whole of her career working in women's health. And at that point, like I realized, I suppose, that women's health is so underfunded and so underappreciated. There's so little that we know. And there is partly what everybody says, oh, it's the stigma and it's sexism and everything, which is very much true. And it's like more true than like we as men normally realize. But it's also very much that the uterus is a black box and we understand very little about it. So I tell people normally that mice do not have a uterus like we have, and we cannot use them as models for biology. And everybody's shocked because you think, oh, like it's a mouse model. You can use it for any disease, but actually for women's health, you cannot use it. And that has led us to not being able to understand the black box. So that was perfect for us. It was like, this is something there's no data. We need to get a lot of data. There's something that we need to do. And with this data, you can do so many cool things. And so many people suffer from like women's health diseases and infertility as well. So let's just go for it.
So, well, I want to very briefly follow up on what you just said. You said you can't really use mouse model for uterine studies, right? What's the reason for that? Because we use mouse models for like so many, pretty much everything.
Yeah. So basically, mice don't menstruate, which is one thing.
Oh, yeah.
Yeah. So it's a whole different way in which like they're like fertile, and it's a whole different way in which like the menstrual cycle works. Um, so basically, physiologically, anatomically, even like more like biochemically as well, the uterus is very different. So whatever you find in a mouse uterus has very little applicability in whatever you will find in like bigger mice, let alone humans. So many people even in the field even consider mice that have been like a distraction essentially in looking at women's health because it's so different.
Wow, I didn't know that. That's so cool. So there's no animal model that's good enough for.
I mean, you can use primates, right? But primates, they're expensive and it's hard to do things on them. And it's actually not ideal as well. And there's only so many things that you can do in primates that you obviously from what you can do in mice. So it's really hard.
Another thing I'm very curious about is very much, I think, a good segue to ask this question. Building in an area where there's no large data sets, there's no kind of underlying standards and benchmarks. Even as you said, biological understanding is not really mature enough, right? Gotta be really challenging, both from a business, both from science, both from a technical standpoint. Can you give me a couple of those hurdles that you really experienced building startup in such space?
I think one thing that we see a lot is that when you're building in a different field, you start from a solid foundation. You start from example that we know this and that, and we are in this good position, and we're missing one piece of the puzzle. And something that I saw a lot academically when I was doing cancer, for example, that like, for example, like how leukemia like roughly works, for example, like which genes drive it. You're just trying to find, for example, oh, if I knock out this gene, which gene interacts with it, or how does it work? With fertility, like nothing, and you, where do you start from and where do you do? So it's a lot of essentially like talking to people, and it's a lot of understanding like how people do, and it's a lot of also like very foundational science like we used to do in cancer in the 80s. And the other thing, because you know so little also, there's very little trust, and rightly so from clinicians to a degree, that obviously it has suffered a lot from obviously people selling stuff that are not particularly high confidence. And to do that, you have to show that you're above that. So also when you say you found something, it's not as easy as with other, say, indications or other things that you can say, I found something because of this and that, and this is a foundation, and this is what I do. And then you can try it in case it doesn't work. You have to really build from that foundation and build up so that you can make people trust you and make people you're not just doing it, say, like for the hype, which the hype, I'll tell you about the hype because it's super interesting because you get both sides. You get people who hear women's health and like, oh, like women's health is so up and coming and so many things happening in women's health. But then the reality of it is that there's a lot of noise maybe coming from women's health, but funding wise and like excitement wise, it's starting slowly to build up. And it's not, like if you read LinkedIn, you think that women's health is like AI, but it's really not. It's we need to get to like a good point.
I mean, Lincoln is a bit of a bubble. You will see everything becoming a trend there,
Yeah.
but then in reality, you realize it's a completely different picture. And it's with anything, right? Like you see that in climate tech, you see that in AI, you see that in other areas in crypto. You see, like wherever there's a kind of a hype, there's a trend, and one VC fund, right? One VC investor I spoke to a long time ago. She mentioned that there's either missionary founders who are obsessed with the mission and they've been obsessed with it before it became trendy. And there's more, in her terms, mercenary founders who just kind of jump on the trend. As they can be successful, it's not to diminish it, but it's because, they see the hype, they see the trend, and they kind of try to, I guess, utilize that. But you're right, like building in such space where not only you're building something, you're also kind of generating very new proprietary data sets that are becoming like new science. You have to show their clinical validity. Not every science has clinical applications or meaningful applications. You have to earn trust, both with patients and clinicians and scientists. And also you have to convince these investors and, other people to kind of commercialize this, to get in, to get funding, etc. So how do you balance that? Like, there's so many things to go after, so many things you have to do at the same time. How do you make sure you kind of like go after those things, but also don't lose your focus, don't lose your attention too much, don't get lost in the details?
I have to say that's the hardest thing to do. I think the hardest thing, because it's very easy in a startup to get drawn by whatever is shiny, whatever little shiny thing is around, and just do things all the time that don't really need anywhere. And yeah, it's very easy to just talk to cool people. And like there was a time like in the early stages that I was just kept having coffee chats, for example, with like doctors, with investors, with everyone. It's just like, I'm just using the startup as an excuse to talk to my friends. This is like what's happening. But I think you have to have real discipline and be almost stoic about it. That like, this is what needs to be done, and this is where we need to be. Almost like think of it like as milestones, which I think is a very VC way of thinking about it. But I think if you think about it as a milestone, so like what needs to be achieved, then you almost work backwards. Like, what do I need to achieve this? And you obviously need to leave like plan Bs and plan Cs and buffer zones and do it. Like I always say I do everything every day. Like sort of 1 hour I'll be doing science, the other hour I'll be doing like legal documents, the other hour I'll be doing something very different. But and I try to almost like leave like concrete blocks essentially to focus on something. But it ends up being almost like basically like 3 different concrete blocks per day that you do of different things. And you don't have like, I don't think you have the luxury of doing one thing and this is just what you do as a startup. You have to play around and you have to do different things.
How do you how do you define the urgency of those milestones, right? What dictates the urgency of those milestones? Is it the external things, or is it more like you have this internal kind of ideas and goals, or like how do you define those things?
And I always think you have to be very unreasonable to do these things. So you have to set crazy goals and you have to go paranoid when you don't reach them basically and just like try as hard as you can to reach them. Like for us, like we for example, like some things that we were doing in the lab, I was like, we need to do this by this and we need to be like at this speed. And then we kept banging on it. It's like, how does it fail? Like, why does it fail? Why is it not at the speed that we want? And we do it in the end at like a speed that is close to that, but not quite. And then we talk to other startups that are doing the same thing, and they do it at speeds like 10 times less than what we do. So clearly, the speed that we wanted at first was slightly unreasonable. But because we kept like solving about it and like banging about it, made us do things faster and do things better, which essentially that I think that's what creates an advantage for a startup, just like solving problems and like solving problems that don't even exist, and just making things like go faster and faster.
A bit of a shoot for the stars, and you land on the moon,
100%.
kind of.
Yes.
Yeah,
Yeah.
fair enough. I think I saw somewhere when I was, looking doing the research for this. I think you mentioned somewhere that women's health is transitioning from era of superficial solutions to more science first, data driven era, right? And as a CTO, as a scientist, how do you define that technical threshold? That where the solution moves from wellness into true precision medicine platform.
Yeah, it's hard to exactly define it because I think we also like we can't be too critical of wellness in that there are things that maybe some people think of as wellness that do have science and evidence behind them. And there are things that some people might sell as wellness or D2C essentially that people think that, but they actually do work and they actually are valid. And yeah, it is very easy to class everything as wellness because everything is sold at booths or something and is not under prescription. But I think there are different levels to that. And as a startup, it's a balance that you have to strike. It's a balance that we have to strike between, is there enough evidence behind it that it will be trusted? And also like, is it something that will move fast enough? Because academically, you can also spend 20 years working on something and building up a huge body of evidence. But at which point is the evidence enough that it can actually be used? I think you have to make that call. And like for me, it's about essentially leading with it and about a conversation to have with the people who will use it and the people who will be impacted by it. So I think we always talk with clinicians and we always talk with essentially patients as well, just to make sure that, like what level of evidence would you trust for this? Like what is useful? What is interesting? Because then this is a very conscious decision. It's also conscious that we went after clinicians first because clinicians are the ones who will have a higher tolerance or like a higher appetite for like more evidence and like more things to see. So it's probably quite easy and like it's the mistake that a lot of people in the femtech world have done in the past that you essentially pack something that might have limited evidence that it works, but like put it in a nice packaging and sell it. But I think actually making sure that, this is something that the clinicians say, this has some evidence, it seems to be working, like it's quite cool and even innovative, let's try it. It counts much more weight on that than the whole like marketing, I think. So we're really that's where I draw the line is, in conversations with everyone, in conversations with the clinicians and the scientists, and always build up evidence. Doesn't mean that something like is going to the market that you stop building evidence. You can still do research and other people can do research as well on it and like build up more evidence. But the moment that someone who knows a lot about it and is impacted by it says that this seems to work, then I think you can start pushing forward.
I see quite few biotech startups like focus quite a bit on publishing research and publishing and which sometimes to me seems a bit counterintuitive and counterproductive because you're like, well, it's not academia anymore. You gotta kind of push it. And what's your take on it? Like how much you should balance this publication and research versus actually like trying to get something out there? And I guess you've been in the space for some time now, boss, and understand you've talked to VCs too. So I'm curious about your perspective.
So I think it's important to publish, like again, as we said, to show credibility and to show that you're doing something cool. And it's important to show that you're doing cool things. I mean, similarly with the AI models, right? I mean, you have the sort of free version that everybody can use, and then you have like the better versions that you can pay to use, and it's obviously like not published, and not everyone can use these things. So I think it's similar in biology that you have things that you publish that you do like cool things that might be interesting to other people. They're not necessarily what's particularly interesting to you or what's gonna make you money or make you grow as a startup, but you've done it as part of what you do, or as part to like grow your startup. So once you've done it, it's almost you can do it, you can package it nicely, and you can essentially give it out to the world where they can do other cool things with it. And then what you can probably keep close to your chest is the things that will actually like make you grow as a startup, and the huge things that you're finding out, which I think, yeah, those obviously you patent and then you grow with that. But I do think though it's important to also publish eventually those, because that's how people trust science even more. So you can say, like, can be empirically things happen, but if you publish your results, then people can scrutinize them, and then people can look at them, and then if they're good, then that builds trust even better. So once you have that, I'm a big fan of publishing, I think, and getting the work out there so people can see what happens. Obviously, not telling your secrets, but
Yeah.
you can delay it a bit.
I guess the reason I'm asking this is because in startups, especially early stage startups, the speed of execution is so important,
Hmm.
and research can be a bit of a long kind of especially if you include peer review process, it can take some
Hmm.
time. So like, how do you balance that so you don't spend so much time on research that you kind of end up deprioritizing the product, the pipeline, or whatever that you're building?
Yeah, and I try to do research towards an end. So at Genie, we do all our research towards something, and there can be research that leads to a product, and there is research that leads to part of a product that is not a product. And like, if you don't know why we did it, for example, you're not going to know why as well and how. So these are pieces of research that can easily be published because you've done it. You may have done, I don't know, like a meta-analysis of this and that for like one particular reason, but the meta-analysis uncovers something different. And it's very easy to just package that and then publish it. But you're not going to say we did it for this. You're going to say we found this because of the meta-analysis. So I think all research should happen for a reason. Like when we grow, I think once you become a much bigger company, then you can start doing research for the sake of research to a degree and for the sake of like building credibility. But for us, like, all research is quite targeted now.
Fair enough. I guess speaking of research, I what I'm curious about is, and correct me if I'm wrong, I think 1/4 of IVF failures are due to uterine health, right? Um, which is quite like significant
It
portion.
is,
But
yeah.
so far, most of the research has been focused on egg quality, egg age, sperm quality. You kind of touched upon that why uterine health has been such a black box. But I'm curious, like, what is there some other reasons why endometriosis haven't been researched that much, that significantly? And what makes, which is in your case, I believe you're focused on menstrual blood, such a key unlock to understanding endometrium?
A large part of understanding fertility and the endometrium, essentially the uterus, is like, as we discussed, mouse models haven't worked, and the uterus is inaccessible. Like, the only way to really get good data historically for the uterus is to do a biopsy, which is basically you go in and you cut a chunk of a woman's uterus, which a woman is not going to do unless she's like quite old or she's like quite desperate and like suffering from things. So you do not have that big amount of data that you would have before. And you do not have that much studying into it. And it's also partly social. Like, you have to admit, it's also partly social that. But I'm just thinking of cancer now. That, like, cancer obviously is the same thing. That, like, obviously, like, traditionally you need to get like some person's like cancer to study it. But because a lot of people suffer with cancer and like men suffer with cancer, we've looked at it. But for women, we haven't looked at endometriosis, say, because even though some women have pain, some women don't. Some doctors believe that women have pain. Some doctors don't believe women have pain. So it's also that. But it is also the inaccessibility, actually, and and the lack of essentially understanding of it. I think that's made a big drawback in understanding reproductive health and understanding the uterus. The only real way to, which is like starting to do things now, is using organoids and like using organ models. It's starting now, and we're seeing like cooler and cooler stuff. But I think there's still a way to go. So for us, the way we see menstrual blood is it provides a gateway into the uterus. It's essentially, it has the uterine cells. It has everything that you need. You can make organ models out of it as well.
Hmm.
It has all
Hmm.
the biomarkers, but it's just there, and you sort of discard it every month. Is the first time that you can actually basically do a biopsy in a woman month after month after month and see what changes, what stays the same. And that's really rich. That's like a huge data set that we can use and make things better.
On that note, why nobody thought of menstrual blood before? Is it what is available now? Is it the biomarkers? Is it the new multiomics tools? Is it the AI models? What's making your approach possible now and so different now?
I think it's a combination of things. Like the first one we always mention is the fact that it's real, that it's hard to actually process. It's not as easy. It's not as easy as peripheral blood or normal blood, basically. So there are different protocols, and
Is it
there's
because of all the noise involved?
it's this is a it basically, if you think about it, it differs from woman to woman. Different women have different flow. Some women have more mucus. Some women have, for example, like more tissue. Some women have more blood. So it's not like you get a blood that you just get a draw. You can control, say, I want to take like 5 ml, I take 5 ml. And then it's blood. Maybe it's hemolyzed, but it's still blood. And you can just process it. Like there's just so many added things. And what day, for example, is a woman on her period? Like, is she taking any hormones? Is she like there's a there's so many things that which make it. I mean, traditionally, the first people who looked at menstrual blood like struggled a lot with this, and they were like, "How do you normalize? How do you make everything the same?" And we have worked a lot on this. Like, this is like a large shark on the R&D of the company has been on that. And how do you make sure that like different women that might have like different flows, different days, different everything, how you're able to process it to get something meaningful out of it. And the second thing is also collection, I think, because collecting menstrual blood has not been easy, I think, traditionally. Now with the menstrual cups getting more prominent, I think it's becoming easier to collect the blood. But before, and yeah, there are companies that have started collecting menstrual blood a few years ago, like developed like a pad, and it was a whole like hardware development thing. So it it's not as easy. Like those are the starting points, and then whatever, like looking at biomarkers, looking at the AI, like looking at the models. Those are things that help on top of that, and I think on top of the initial hurdles.
When there's so much variety and diversity of data, I'm assuming there's also quite a bit of noise in the data. So
100%.
is it AI that helps you to kind of get rid of that noise and try to find meaningful signals, or is it? I guess it's what's making it a bit
Yeah.
possible too, right?
The AI helps a lot, definitely, because I think that's what AI does. It just helps with like getting meaningful data out of nothing, essentially. But also, to a degree, I think it's the multi-omics advent that you can do, because now you can, by looking at a larger number of things and looking at, like different things that interact on different levels, you can start inferring stuff, and you can start seeing, like what makes sense. So you can start building networks and see like, hey, like, is this network real or is it fake? And sometimes you get a signal, and maybe like the things that should correlate with don't correlate with it, which probably means it's fake. And it's just something that's an artifact. But sometimes you do get a signal that seems real, and you can get things out of it. So definitely AI and multi-omics and the ability to build networks and do high scale testing helps a lot, because you can spot things, you can spot more things, you can spot more normalizing factors, everything.
And if I'm not mistaken, you're starting with IVF first as a kind of like the first indication to go after. Um, but from the way I understand the platform, is a quite broad platform and will most likely have quite a few applications and in other conditions too. My question to you is like, how different is, it might be a bit of an ignorant question, but I'm curious, like how different is the biomarker signature for, IVF implementation readiness versus endometriosis versus, PCOS, the different other conditions. How are they wildly different, or is it?
I mean, they are different is a short answer. The long answer is that, I mean, even if you think at IVF and fertility, it contains a lot of these things, because a lot of women who have endometriosis are infertile. A lot of women who have PCOS also have problems with fertility. And a lot of other things, like this talks about, like implantation windows, it talks talk about inflammations, it talk about infections. And all these things, I mean, we put them under the umbrella of IVF, but in reality, it's almost like slightly like a few different things that they might have biomarkers in common, and there are biomarkers in common in some of them. There are biomarkers that are very different in some of them. So it almost becomes a pipeline that builds itself. I think that you start from something and you can do so many things because they all essentially are central, and it comes from the fact that the uterus is central for women's health. That like you can stem many things out.
I'm assuming the goal eventually is to be able to screen those different things from a simple blood test. Is that what you envision for the future?
That would be the goal. That would be the goal. I think at the expense of potentially sounding like Theranos, but I think uh,
No, I
that's
meant in terms of like, endometriosis or other conditions. I'm assuming you would like to get to a point where you can, I guess, eventually
yeah. Look for all
sample.
the indications.
Yeah,
Yeah,
fair enough.
yeah, and then I
Um,
think it's menstrual blood is so rich that you can do a lot of things.
and how do you think? Because I remember when I did very short stint of internship at license consulting firm. One of the key things, even the biggest pharma companies were focused on is indication prioritization, which indications to pursue first. Even the biggest ones with a lot of capitals, they still try to focus on very narrow. So how do you think of that sequencing? Which ones to pursue first, which ones to focus on first? Is kind of like is it dictated by more the commercial kind of factors, external commercial factors, or is it like there's a certain science behind it?
I think you have to look at both. I think you have to look, obviously, what has a commercial possibility and what is something that there are a lot of patients, there's an unmet medical need, essentially, and you can offer. But it also has to be something that we can realistically do. And I think the difference of being in a startup versus being in a large pharma is that a large pharma, potentially, if they want, they can do a bit half and half and like focus on a lot of indications. Like for us, as a startup, you have a certain runway, and with the runway, you cannot do 5 indications. You can do one, maybe two. So it's very much of showing one thing, and that one thing is going to lead you to the next, and essentially doing continuous proof of concepts in like significantly bigger market. And for us, I think like IVF struck out because it's essentially a lot of people, like a very large unmet medical need. There's a lot of people that need to do it, but it's also an area that you can offer something, and you can offer something like reasonable. And we as a Genie, we can actually do things and make this forward. So I think that was a start. And then the others, they also go this, yeah, I'm not going to be so crude as to call it like market size, but essentially, like patients who need it, like who pays for it, and what can we do as Genie to actually bring this forward.
Jenny is a very fitting name. It's a really cool name. Um, in terms of, I guess, customer profiles, and I'm obviously I don't want to any confidential business decisions. I'm just more curious in terms of, do you see this Genie's product being the end user, being the patient, being the clinician, being the hospital or the pharma? Like, how do you think of, or is it going to be a combination of those things?
I think everyone obviously will interact with it at some point. And I think we do want the clinician to be involved in it and like have it essentially be the one that believes in Genie essentially, because as we discussed, that leads to credibility, and that makes something that people can trust. So it's one thing, I think, selling direct to the consumer. It's different if the clinician is able to trust this and say this is something that works. And I think at the end of the day, people are getting more and more health data and more health conscious as well. But for the time being, getting the clinician buy-in is super important for Genie. Getting people to trust us.
I'm asking way too many commercial questions, but it's I guess part of it because so for my podcast, I interview fathers, but also interview investors, so I kind of get perspectives from both. And I guess another commercial question coming your way is, what's the appetite for a solution product like this, right? I think when I look at women's health space, I will. I'm not I would say I'm a bit ignorant. I know, for example, Flow Health is a
Hmm.
massive consumer startup, very D2C. And Maven Clinic is very much kind of managing payments and like the end-to-end kind of patient management, virtual clinic, and just a bunch of things, right? Um, this your solution goes into a bit of a kind of deep tech biotech space. So I'm curious, like from a commercial perspective, what's the business appetite for it, but also what's the VC kind of appetite, interest in this space?
Yeah, well, I would say like business, I think we do see a lot of demand from doctors and from patients as well. Like we've tried like all our partners, like all the clinics that we work with, like it's all been organic. That like we we actually get people who want to work with us, and
Wow,
we yeah
that's the
we
best signal.
yeah, like we don't want to be begging people, oh please, like let's just do a pilot or whatever. It's we want people who want to work with us, and we gel well, and it's becoming like great partnerships. So I would say that that's a commercial side that like we do see, and the clinicians do say that like this is something that we really need. This is something that is missing. This is something that has a lot of potential. So that's motivates us. From the investor side, I mean, we also have great investors. I would say the investors obviously is not going to be for everyone. It's you have to have some appetite that like we need to do some R&D, we need to do some things. It's we try to be as fast as possible, so it's somewhat essentially fast commercialization, hopefully. But again, it's not the same as an AI agent for marketing, for example. So it's I think you have to understand that to invest in Genie, for example, and you have to also understand that this is something that has different plays. It's you start with this, and like there's like different levels of risk, there's different levels of success as well, and there's different morphs into it. And it's something that I think more and more investors are like getting into. We did start, I think, Genie at an interesting point where, I mean, it was a sort of slump after COVID that is still ongoing in biotech. So that is something, but I do think there's more and more people rising up, and there's more and more biotech funds that are we see raising recently. So that's quite a good signal. And yeah, and we do see, I mean, a lot of the essentially health and like longevity thing, which is good, like people getting their health into their own hands and like understanding how their body works, which is, I think, in the long run, it's going to be good.
What's the typical VC profile? Is it more biotech? Is it more health tech? Or is it very focused on femtech, women's health?
From our investors, I would say most are generalist. So yeah, like
That's interesting.
most are generalists, but they're generalists who understand bio. They're the generalists who we have people who like have invested in early diagnostics, like things like Zoe, for example. We have people who have done early diagnostics themselves. We have people who have yeah, essentially just an understanding of the space through like past investments. But and we also have some biotech people who are very much like hardcore biotech, like a lot of hard work. But it's a combination. I think it's people who understand it though. I think that's a unifying part. Is people who are able to understand bio and are able to understand what we do.
Andres, you're building in a very interesting but quite challenging space, right? And going back to my earlier point, there's so many things you have to do at the same time, but also there's so many different opinions and thoughts you get, from investors, from doctors, from patients, from scientists. At the end of the day, I'm assuming it's up to you, like to know, okay, how to avoid noise, how to focus on the ones that matter, which is a very hard thing to do. Even when you're building a SaaS startup, software startup, it's a very hard thing to do where you end up losing the product market fit because you'll end up listening to so many different kind of voices. And so what's your approach in kind of maintaining that focus?
Yeah, no, I'm laughing because this is so true. Like like I think I always say that starting the startup, like everybody I know has given me advice. Like everybody has met me has given me advice, one thing or another. And it's very easy to just listen to things and panic if someone doesn't like what you do, or if someone thinks, I don't know, your voice is too ugly or whatever, which is, yeah, it's something I've heard. Don't laugh.
Oh God, that's rude.
I know, but yeah, it's funny. It's funny. But I think that's the thing. You learn to filter things, and you learn to almost like test it. Okay, like you've given me this advice. I'm gonna put it in the back of my head. I might play around with it for like an hour or two. If it's something I can play around, I might try talking in a different voice and see what happens. But I think ultimately it's about instinct, and it's about, like, what should I try, and like what advice has more credentials behind it, and like what also is more qualified. So I think you have to qualify any advice that you get given. So like, if an AI person wants to give you advice on how to run your mass spec, you're probably not going to listen. And yeah, and I've had that as well.
Wow.
Yeah. So it's again, it's about doing all these things and like filtering things out, and the advice that you classify as important advice, again, you go and test it and you see that like it's actually valid and validated. The advice that you classify as maybe this has merit, again, you test it, but maybe like devote less time to it. And then there's advice you just don't listen to, and then just keep it for anecdotes like now.
That's you decide on based on gut instinct, essentially.
And the guidance, but also like who gives the advice and like how qualified
The
they are.
source of the advice.
Yeah.
Fair, fair. You're kind of piloting in UK, Cyprus, and Spain, right? Very interesting. I'm very curious about the choice of countries too. Spain, UK, and Cyprus. But also, I'm very quickly wondering, like, how does it integrate into clinics' existing workflows? Is it something that the doctor is owning, or is it? What's the process like?
Yeah, we want the doctor. I mean, obviously the doctor, we want them to love it, but we also want the doctor to do as little as possible. Because I think part of the idea is that the the doctor shouldn't waste their time on doing like weird operations and interventions. So it's something that should be quite easy. Like the doctor prescribes, and then the patient can collect the sample and then send it back to us so we can analyze it and process it. So this is how we're trying to fit it. I think it's yeah, trying to do it as low touch as possible for everyone, so it's super easy to do.
And may I ask why Spain, UK, Cyprus?
Yeah, I mean, UK is the easy one because obviously
Yeah,
we are
yeah,
based in
sure, yeah,
London, so
yeah.
it's sort of where our network is and where our growth is as well. Um, Cyprus is slightly similar because I'm from Cyprus,
Yeah.
so and also like I have quite a good network there, and we met some like great people there who were like really like good innovation, like really good science as well. So we're working with them. And Spain is interesting because it's a good hub for IVF in Europe as well. There's a lot of IVF tourism in the Iberian Peninsula, so it's
Wow.
yeah, it's a great place to do IVF because it's, I mean, slightly cheaper as well. There's like still like very good science in Spain. Some of the bigger IVF clinics in the world like started in Spain, so it's
Wow. I'm learning so much from
it's a
you.
really good place for IVF. So yeah.
Wow. That's really cool. Um, I guess another very interesting thing here is, and you mentioned it already, is that traditional way some of those things like diagnose is very much through very painful surgery, biopsy. That's why things like endometriosis, I think, takes like 7 to 10 years to diagnose because, um, and another thing you also kind of touched upon is that women's health issues, disease can be quite debilitating, but are often not fatal. So that ends up delaying the diagnosis period quite a bit too. By making the process less invasive and not painful at all, you're really changing the patient's relationship with their health and data too. So I guess what have you heard, from patients in terms of how they engage with their data, their fertility journey, with their health really?
Yeah, I think that's exactly right. As you say, you essentially is lowering the activation energy for people to get their data and get the understanding of their health. And like like I think patients really like that. So like from the people we engage with, they could constantly ask, "Oh, like how is it going? Like what am I learning?" That I think it's very exciting to be able to understand. We've done a bit of that work of like what people call essentially like patient information and engagement. That like you get people to see, okay, like what format would you like your data to get? Like what would you be interested to see? What would you not be interested to see? what would you like your experience to be in general? Even like, how would you like to collect the sample? Like, what is easiest for you? What, like, do those instructions make any sense? And we do a lot of work in that. And I think giving people power through the data is super important. But it's also super important, as I said, to like work with clinicians to make sure that the power is also like correctly identified and correctly not, I wouldn't say guided, but almost in a consulting way, like this is the data and this is what it means. And uh, now it's very easy to go on the internet and find a lot of different things. But if you do it
Yeah.
at the same time, then
Yeah. Yeah.
it's easy to, if you have a good doctor, I mean, and you can trust them, which you
Yeah.
should, then it's
Yeah. I
important.
think with the explosion of AI, there's been a massive explosion in data generation, but we often don't know what to do with that data. And
Yeah,
I think you're right that it's very important to actually know what are the next steps are, what are the meaningful kind of steps after that, what comes after that.
exactly.
Um,
And even with like materials, like there's so much AI doctors talking now, like on YouTube, for example, like you can find so many people that are trying to sell you something, but they present it, oh, I found like everybody got it wrong about cancer. And I'm a doctor with 20 years of
yeah,
experience and I found out this. And it's,
yeah,
yeah,
yeah. No, you're so right, and I think that's one of the most wonderful things you guys are doing, giving both patients and clinicians agency and power. It's really cool. We are coming towards the end of our episode, so I'm going to ask more, I guess, two questions to finish it off. One is coming from a science background where you have to kind of move slowly, test, publish, wait, versus startup environment where you have to move fast, break things, build things, and get feedback fast, and then you iterate fast. How do you balance those two things?
yeah. And I think it definitely have to be rigorous. And it is part of what needs to be done with the like new generation sort of women's health, as we said, that it's, you have to be rigorous, you have to do things properly, and you also do have to move really fast. I think the only way to do it is to be really proactive and like almost playing chess essentially, saying like, if I make this move, what can go wrong? Or like, if I do this experiment, what are the 15 things that can go wrong? And how do I stop this from going wrong by making like maybe a different move, for example, or by having like things railguard. And it essentially just make sure that like the things that need to be done in research go uninterrupted, because research is going to happen. Research is almost essentially you're banging against something, but essentially what you're doing is you're unveiling the truth of what already exists to a degree. Like you cannot cook results, you cannot obviously like fake data. It's like the data is what happens. So what you can do though is like predict what might go wrong and then have like backups about it and then be smart about it. So things like doing regs on time, like having like your contractors on time, having like your partners and like timelines correct. I think those are all things that if you do them right, it saves you so much time. Because research is going to go wrong and it is going to go wrong. It's going to be slow. But I think this is it. Just like set up backups, like make everything else as smooth as possible so that research has to take its speed and just like do it.
Andreas, I learned so much from you in this episode, and I very much enjoyed talking to you. I guess my final question to you, and I don't like to say if, I like to say when, because if introduces doubt, and I don't doubt you. I think you guys are going to be very successful. Um, when Genie works the way you hope it will, what does the fertility journey, women's health journey, look differently in the next 5 to 10 years?
I think we will live in a world that women can get a diagnosis and treatment for their conditions in months versus years or even like weeks. And IVF will no longer be guesswork. It's not like there is some element of guesswork now with the uterus, so it will no longer be that like you start and you don't know if you need one or if you need 2 rounds, if you need 3 rounds. You're gonna go and I have these issues. This is what I'm gonna treat. This is how it's gonna happen. It's gonna be like very precise. And the same with other women's health conditions. Hopefully, we're gonna see some more treatments for things like endometriosis, PCOS, other things as well. And ultimately, it's going to be understanding those issues and starting to address them much, much faster.
Andreas, I wish you tons of luck within this journey. Um, Tons of
Thank
luck,
you.
and I hope everything works out just the way you want it to work out. Thank you so much for such an interesting and insightful episode.
Thank you. Great conversation.